All right. Hi, everybody. So we are live. We're going to have a great discussion tonight. I hope you're all ready. Waiting for our guests to sign on. But hi, for those who don't know me, I'm Tony Vermontes. I'm the Director of Health and Prevention Services at the LGBTQ Center Orange. And we've had a lot of great work happening over the past few years, but this year specifically, despite the challenges of COVID and everything that came with 2020. Hey, Danny.
Hello, how are you? Good, can you hear me?
Yeah, well, I can hear you. Can you hear me?
I can hear you.
Perfect. I love the hair.
Oh, thanks.
So I was just doing a brief introduction saying that despite the challenges of 2020 and everything that COVID brought, we have been fighting the good fight at the center to bring new health programs that really focus on providing health equity for the LGBTQ community. And part of the programs is having conversations like this one. We're going to have many info nights in the next few years, and I could not be happier and more thrilled to have the first ever info night be with you, Danny. We go way back. I known you for years. You're one of my dearest friends. We've worked together. For those who don't know, me and Danny go way back. We've worked together for years, and this is just a treat for me to be working with him one more time tonight.
Yeah, it's definitely a treat to be with you too. I mean, it's been 3 years since we've really done something together. So I'm really excited. The Danny Tony team is back together.
Shows, we used to do trainings all over, and it would be stand-up comedy. So, but I'll do a formal introduction because again, Danny needs no introduction. He is known nationally for his fantastic work in the LGBTQ community. But for those who don't know, Danny is just an amazing, he's a public health expert. He's a founding member of CODE, which is the Coalition of Demographic Data Equity, working together with the Williams Institute, with UCLA, with the Trevor Project, the LA LGBTQ Center, the Office of AIDS, and other great partners to create this coalition that collects data and then provides equity in data collection. Danny is currently with Health Access. Danny is an expert in program development, an expert in health advocacy, an LGBTQ health expert, a leader in LGBTQ health with partners in the tobacco control program in California. Again, you need no introduction. Danny, you are a friend, you are family, you are my better half. Welcome.
Thank you. And I'm still waiting for the spousal support to hit my bank account.
Days. Keep asking your lawyer. So, again, we wanted to talk tonight specifically about tobacco use among the LGBTQ community, and I know it's something you've been doing for a very long time. But tell us a little bit about you, Danny. We'll start it off there. How long have you been in public health?
So actually, I've been involved in public health since I met you, Tony. You're the one that got me involved in it.
What?
Yeah.
I can't take for that.
You did. No, it really was you, because I remember when I first came to the center as a volunteer and then as staff, you and I were just sitting there perplexed, like with how difficult it was to find, trans affirming providers, LGBTQ affirming providers, therapists who accepted insurances, and just how many of our community members didn't have access to insurance. And then when we were training medical providers and how many of them did not know about the disparities that the queer community experienced, it was just like, how do you not know about this? How do you not know how to treat a gay man living with HIV or the trans community? How do you not know how to work with bisexual and pansexual individuals? So that really gave me the motivation to go back to school to get my master's in public health. So really, you just really opening up my eyes, and us doing that work together really got me involved into it.
Oh, Danny, that's, very humbling to hear that. It's all you. I remember we would sit in our office and bang our heads against our desk thinking, what are we going to do? What can we do? How are we going to do it? We, as public health providers, we face so many barriers, but but here we are, you know. But you've been doing public health for years. You've been a self advocate for your own health for years, and I always found you inspiring and your story inspiring, and you always gave me fuel to want to do more and break more barriers down.
Yeah, I think we fueled each other because we were both frustrated, but lifting each other up. Like, we're going to break down walls and we're going to redo what healthcare looks like in Orange County.
Exactly. Specifically focusing on LGBTQ health, because the community, we've been ignored for years, and we need health equity. Everybody does, but LGBTQ community folks in Orange County have been ignored for centuries, and it's time for us to change that. We need to really be present and be here. So, Dannie, we recently launched a tobacco cessation program, and we'll talk about that a little later. But we've gotten a lot of questions, and one of the biggest questions that keeps coming up a lot is, how is smoking and tobacco use an LGBTQ issue?
You know, that's a really good question. And I had even asked that myself when I first kind of got involved in tobacco control and started working with the Department of Public Health. And really just seeing how much the tobacco industry targets our community, knowing that we experience high rates of family rejection, discrimination in medical settings, discrimination in employment, and the fact that we really do congregate, you know, at bar scenes, at club scenes, at drag shows, at brunch, really looking for that sense of community. And just really targeting us in those type of places. I remember when I first came out and I started hitting the bar and club scene, and I'm totally going to age myself right now, but I remember there were cigarette girls and cigarette guys walking around asking, you know, hey, do you want a free pack of cigarettes? Here's some coupons and here's this. And really meeting people by getting that free package of tobacco products and asking folks like, do you have a light? Do you have a match? You know, bumming cigarettes off of each other. And same thing in college when I was in my undergrad, you know, hanging out in the student union or in the quad and, you know, finding community in that area and making friends by saying, hey, do you have a light? You know, can I bum a smoke off of you? So, and then even seeing how much they're even funding our pride events. You know, how much does our community hurt for funding? And the tobacco industry knows this. It's like, hey, we're going to help you build this sense of community if you advertise our products or, you know, put our logo in your banner or on your website. You know, here's $10,000, you know, and we don't think about those things, you know, of how much they target us. And then even just thinking about our own mental health. You know, I mentioned we experience, you know, high rates of family rejection and homelessness and discrimination. And for so many of us that do experience depression and anxiety or even hunger, you know, what is that one coping mechanism that we can control or even afford that we reached for? And it's a tobacco product. And right now, our community utilizes tobacco products 6 times more than a national average. So while tobacco usage is going down for the heteronormative community, our rates are going up and they're utilizing our own hurt and pain and rejection to make money off of it.
It's, yeah. I completely agree. You know, I remember back in my, now I'll age myself, back in my days, I used to go to Tiger Heat, and I don't know if it's around anymore, but it used to be super poppin' back in the 2000s. And yeah, feeling like that really shy kid outside with no one to talk to. So you'd go out to the patio, and bumming a cigarette almost became a bridge to communicate with other people, right? It was like, now we have some common ground. We're both smoking. So I completely relate to that, to feeling needing that sense of connection with someone, and tobacco knowing that their products are a bridge for our human connection with others.
Yeah, absolutely.
So let's talk about, you know, how do you think tobacco, and I know there's not a lot of data and research on this, but how do you think tobacco products affect a trans person who's going through a gender transition?
Oh man, you know, actually, in May, I'll be 10 years tobacco free.
Wow.
And really it had to do because of my gender transition. You know, when I was first learning about like, you know, how is hormones going to affect me and surgeries and such. And I really learned that, you know, transitioning from female to male and going on testosterone, you know, our red blood cell count goes up. You know, we're at higher risk for blood clots and heart attack and stroke. Same thing for transgender women, you know, who are taking estrogen or even hormone blockers as well. You know, we're just at higher risk, you know, for higher blood pressure. We now got to take things like Lipitor and, you know, just really take care of our overall health. But when we utilize tobacco products, because now we're at higher risk for heart attack and stroke because of our gender transition and the way hormones affects our body, now by utilizing tobacco products, it elevates those risks even more. You know, so that, and that's not even thinking about surgery, because when you think about surgery and stuff, you know, the surgeons are cutting into our blood vessels. You know, I just had surgery a month ago, you know, for my gender transition. And, you know, they basically cut me in half to do what they needed to do. So that's lymph nodes that's being cut into, that's blood vessels that's being cut into, tissue, all of that stuff. So when we utilize tobacco products, it really affects our healing. You know, our blood vessels become constricted. They don't heal properly. We're at higher risk for skin tissue death as well as ugly scarring, which for any trans person, we don't want to have visible scars. We don't want that ugly scarring. So it really does affect us, which is why a lot of surgeons say, you know, you need to stop utilizing tobacco products at least a month before your surgery and up to a month afterwards. Because even if you utilize, you think like, okay, well, I'm going to vape because vape is going to be so much healthier than utilizing a combustible cigarette, you still get that coughing effect. And when you're coughing and stuff, it really can burst open your sutures, which can give you even more complications in your healing process. So even just thinking about those things of like, okay, wow, like I have all of these elevated risks now in my gender transition, and tobacco products just really puts it through the roof. It really forced me to think about like, okay, do I want to have a healthy and safe transition with the least amount of things that can go wrong? Or do I really want to risk it by continuing to use these products, including e-cigs? Because I did transition from combustible to like e-cigs and vaping products thinking it would be so much healthier. And the truth was it isn't, you know? And because I gave that up, I've had a very successful transition with very minimal surgical setbacks.
No, I love it. Thank you. And you know, I've heard you talk before. I literally am one of your biggest fans. You mentioned in a talk before talking about the same issue. There's also, I mean, again, because in order to heal properly, you know, blood needs to be running through the body, and I know tobacco can prevent that from happening. But you mentioned in one of your talks that there's also a possibility during chest surgeries that the nipples could potentially fall off because as a result of improper healing due to tobacco usage.
Oh yeah, absolutely. You know, you can have nipple rejection, you can have fallow rejection, you can have complications with breast augmentation as well, if you're transitioning male to female. Same thing with vaginoplasty, you know, you can have skin and tissue death where you're going to have to go back in for reconstructive surgeries, which can end up being, you know, 3, 4, 5 additional surgeries, you know, just from utilizing tobacco products, you know. So it's really important to really think about, is it worth it to utilize those items to ease your anxiety and depression? Because I get why we use it. You know, we're super anxious, we have a lot of depression, especially around gender dysphoria, and then just even the anxiety of like, is my surgery actually going to go through? Is my insurance going to cover it? Did I fundraise enough money? There's a lot that's you're feeling emotionally and mentally. So of course, reaching for that product, it kind of brings things down, and you're like, okay, I can exhale for a moment, but is it worth it Or does it make more sense to learn more positive coping mechanisms without reaching for that product by working with a mental health provider?
Of course, of course. And speaking of, we've talked a little bit about the social determinants, right? Because again, as LGBTQ people, we are exposed to multiple environmental and interpersonal factors, right? Like social economic status, or social structures that influence our health at greater levels than other individuals, perhaps. What do you feel are some of the social determinants that may lead LGBTQ people to pick up smoking?
Oh my gosh, that is such a great question, because this is actually what I'm talking to CDPH about and everything, and drafting a whole policy and systemic platform with recommendations for the states. And really, if we really want to eradicate tobacco in California by 2035, we have to address social determinants of health, which means we have to provide mental health services for the LGBTQ community. With family rejection, the fear of family rejection, the whole coming out process, we need support groups. We need mental health providers. When it comes to housing and unemployment or employment discriminations, we need to address that. Yes, we have amazing laws here in California that states, like, you can't discriminate when it comes to hiring someone or providing someone housing. But let's be real, it still happens. Mm-hmm. What can we do? What systems can we put in place to ensure that LGBTQ people get the housing needed, that LGBTQ people are hired in jobs that they are absolutely qualified for, but are looked over due to their sexual orientation and gender identity? We also need to provide housing for the homeless as well. This includes for LGBTQ youth, LGBTQ adults, and our senior community. We're really great at forgetting about our LGBTQ seniors who led the charge, at Stonewall during the HIV pandemic, and now they're the ones struggling and about to be evicted because they don't make enough in Social Security. So we need to provide housing services for free for our community members who cannot afford the housing. We also need to create systemic change in access to medical care. Having the laws is not enough. We need to ensure that they are implemented and enforced from the top down. This includes at the CDPH level, at the Department of Managed Healthcare level, at the hospital Medi-Cal level as well. Cal Optima should be held accountable. LA Care, IEHP, all of these different insurance agencies need to be held accountable, because it should not cost us all of this time to advocate for ourselves to access our health care or to get prior authorization for medications we absolutely need to treat our HIV or to undergo our gender transition. So until we address every social determinant of health that our community experiences on a systemic policy and funding level, we are never going to reduce our tobacco usage rate of more than higher than 6% than the general population.
Oh, preach, brother. That's super powerful. I agree. Yeah. We've touched a little bit about mental health, but how is tobacco linked to mental health?
So it's really what I explained earlier, the depression, the anxiety, the fear, how many of our youth, young adults and seniors, are homeless or on the verge of homelessness, and because of those stressors of, life, of just being queer, just for existing and feeling all of these different emotions and mental health disparities that we experience, that it's just, this is something I can control. I might not be able to afford dinner tonight, but I can afford a couple of cigarettes, or I can bum something off of someone and it'll curb my hunger. Wow. It'll ease my anxiety. It's something that we can control. And really, when we talk about tobacco and we talk about cessation and mental health, we need to stop treating the symptom, which is tobacco usage, and really start treating the root cause and really asking in these therapy sessions, how are you really? And what is it that you are struggling with? Yes, I understand you're struggling with tobacco usage, but that's just the symptom of the root cause. Let's get to the roots of what are you anxious about? What is it that you're depressed about? What is it that you're struggling with? What are your fears that you are facing right now that you do not know how to tackle? And let's come up with positive coping mechanism, and let's come up with a systemic way to navigate this situation in a positive manner. Because when we address the root cause, then that symptom will no longer exist.
I love that. Addressing the interpersonal barriers while also looking at the social determinants. So really, to provide support for LGBTQ individuals who smoke and health equity for LGBTQ people, we must look at all the structures. You said it, the depression, the anxiety, the shame that we carry. Look at those root causes, and then look how those play or those react, right, to the environment of the individual where we're living, the social structures, the oppression, the sexism, the homophobia that we live within. That's fantastic. We have a lot of work to do, Dannie.
We do. I mean, even look at our own intersectionalities, you know, yeah. I mean, you know, we're both, you know, queer, we're Latinx, you know, and how much does that play a barrier, even just in our jobs? You know, the systemic racism that we experience, the discrimination, you know, knowing that we're just a little bit more effeminate than a cisgender heterosexual man. And right, Tony? Do you still have the wig in the office?
Absolutely. Should I run and get it?
Yes.
Oh, and I have all my crowns too.
Of course you do. But, you know, knowing that, you know, and knowing how people view us when we walk in a room, people already clock us. This person's queer. This person's gay. You know, I mean, here I am going into state meetings with a nose ring on, you know, and everything. And people just know, like, yep, this is who that person is. And even though I have the degrees and education to back up my expertise, you know, and I have a very extensive CV, I constantly have to prove who I am because who I am ethnically and because of my gender identity and sexual orientation. But everyone else in that room does not have to prove their worth.
And you know, we actually have a question from our audience, so we'll take that right now. It says, how does the smoking differ from abuse of alcohol, and shouldn't both be tackled at the same time?
Yeah, so you know what? That's absolutely right. You know, smoking and alcohol really does go hand in hand. Not just drinking, but the abuse of alcohol. You know, really drowning your sorrows and all of those things. And yes, they should be tackled at the same time. But again, the way we need to tackle it is not treating the symptom, but really going back to the social determinants of health. What is going on in that person's experience? You know, are they experiencing, you know, the family rejection, the threat of homelessness, or actually, you know, experiencing homelessness? Are they having a hard time finding a job due to who they are? There's just so many components into it. And we just really need to stop passing policy that outlaws what people do, and stop just focusing on that. I mean, policy is great. You know, yes, let's protect our community. But if we're going to pass policy, we also need to change the systems.
Correct. So speaking of you know, kind of barriers, right? That like the structural barriers that exist in terms of addressing social determinants. What barriers do you think exist for LGBTQ people who want to quit smoking?
Honestly, the biggest barrier that I hear across the state is discrimination. You know, it's being misgendered. It's being made fun of because you're gay and lesbian. You know, before we did a huge training with the quit line, with the California quit line, we were getting a lot of complaints of, you know, I'm calling in, I'm being misgendered, even though I say my pronouns are this or that, or when I say that, you know, I'm gay and I need help, you know, and they just don't know where to refer me. And I feel like they're just not helpful. It's just, oh yeah, we just want to get you involved. You know, here's some patches, here's some gum, good luck. you know, where it's more of like, no, like there's so much more that I'm experiencing as a gay person, as a lesbian individual, as someone who identifies as trans. So really just training up, you know, quit line services and county services to where it's not just here's gum, here's patches, good luck, but really having a full packet of here's the information to your local LGBTQ center, here's the support groups they provide, here's the mental health services they provide. As a matter of fact, let us help you get plugged in with their mental health services. Let us help you get plugged in with their support groups. Have you thought about volunteering and gaining community with your local center? You know, because how many folks, you know, in various areas don't realize there's an LGBTQ center maybe right up the freeway from them. And now in this pandemic, everything is accessible virtually, you know, where folks can go to a support group virtually. Same thing with our youth, you know, so really changing the way that cessation looks like for our community and making it whole health and providing direct linkage to organizations such as the Center OC.
You know, I was going to say our studio audience is going wild. Thank you all. I really appreciate all the hearts are filling me with joy. So thank you all so much. We have another question. It says, it's something to the effect of, do you think that marijuana is as addictive as tobacco?
You know what? There's studies that show both ends of it, that it can be addictive, especially if it's utilized as a coping mechanism. And then there's others that says that it's great for, you know, medicinal purposes, you know, which is true. You know, it just really depends on the person. I am a person that 100% believes in harm reduction. I really believe that if we can utilize harm reduction in a positive way, why not utilize it? And this is something that the state does know about me. CDPH knows I advocate for this, especially with the gender diverse community. You know, I talked about earlier how utilizing tobacco during a gender transition could harm the healing process, you know, and even harm our health by elevating our risk factors for heart attack and stroke. However, knowing what the coughing effect does and how it can harm our surgical procedures, utilizing edibles to manage your anxiety and depression and gender dysphoria while undergoing surgeries is a lot safer than utilizing something that's combustible or that you inhale, you know, where that gives you the coughing effect. Now, with that being said, even though I'm an advocate for harm reduction, it's still highly recommended, and I'm going to say this very strongly, please talk to your doctor about it first. You know, talk to them, get their opinion on it, get a prescription. You know, we see what's going on right now with the injustices going on racially, you know, with police brutality. And, you know, we're just seeing so much happen in our communities. I don't want to see anything happen to any of you. So having that doctor's prescription is really important, especially if you're going to drive from the dispensary back home and such. You know, have that prescription, talk to your doctor, talk to your mental health provider, make sure that you are 100% honest with them about what you're using. So that way, as you are tapering off of tobacco products, as you are tapering off of cannabis products and learning more positive coping mechanisms and more healthier ways to navigate life, you know, they're right there with you each step of the way. You know, so really protect yourself. That is 100% important, you know, especially with what's going on politically, social justice, racial justice, all of those things. Just be protected.
Thank you. Thank you for that. I can completely agree. Let's switch gears a little bit because I want to ask you this question because since I've known you, I think you are the most meticulous and amazing data collection person I know. So, and I know that your work has driven you to a lot of data collection greatness. So, tell us a little bit about what is SOGI data? What does that stand for? What does it mean? And why is it important?
Yeah, so SOGI data is sexual orientation, gender identity, and what it is it's three questions really, and it's when you're being asked demographic questions. You know, how many times do we go to the doctor, or we fill out an intake form, even online when we want to try to win a free gift certificate, it ends up being a scam. Not that I've fallen for those, but you know, it's happened. But you know, when you're asked your age, you know, what's your ethnicity, you know, where do you live, things like that. Well, it's three questions of what was your assigned sex at birth, you know, male, female, intersex. So it should be those three. What is your sexual orientation? And you should be able to choose from gay, lesbian, bisexual, pansexual, queer, and others. And then the third question is, what is your gender identity? You know, man, woman, trans man, trans woman, non-binary, other, you know, fill in the blank. And the reason why it's so important to ask these questions is because we really don't know how many of us are out there, you know. And with the 2020 census that happened last year, we had this great opportunity to collect that data and to actually know how many gay men live in the US, how many lesbian women, bisexual folks, transgender folks, and we lost that opportunity by not collecting that data. So now it's really up to each state to collect it. And the reason why it's so important to collect it is so that way we know on the public health side what type of policies and funding should we recommend, and say, hey, because Southern California has over, let's say, you know, over 3 million LGBTQ people there, and here's the data to prove it. These are the healthcare services, social services, housing services that should be funded in this area. But because we really don't have that data and we're just kind of guesstimating and, you know, working with the Williams Institute, we're doing all that we can, you know, by collecting what we can with the California Health Interview Survey and California Health Interview Kids Survey. We still don't interview every single Californian. It's still very much a small sample. So all we can do is say, well, here's a small sample of who we've interviewed. And out of this small sample, this is the percentage that identified as LGBTQ. So we're going to guesstimate there's this many of us living in California. We're doing our best to say, these are the programs we feel CDPH should fund. And these are the new type of funding our legislators should now enact and include in the governor's budget. You know, 2 years ago, we were able to successfully advocate for a lesbian, bisexual, and queer women's budget. You know, so now we're getting funding into the Office of Health Equity, where we can provide grant opportunities to LGBTQ organizations to apply for that funding. And then last year we got AB 2218 signed, where now we're going to have a trans health budget as well, where organizations can apply for funding to promote health equity within the trans community. We are not able to do that unless we get this data. So the more data we have, the more people voluntarily say, yes, I will say, you know, how I identify, what my sexual orientation is, you know, all of that stuff. It really helps us as we develop these policies and advocate for this funding.
That's fantastic. It really, and it trickles down to the communities. We are able to make change at the local level when that data is properly collected. Super exciting. We have more questions coming in, Dannie. We have a question. It's asking, has the pandemic increased tobacco use?
Yes, it has. We have seen it. We've seen it in research. We're seeing, I think from the last research I saw earlier today, it was increased by 24%.
Wow. Wow. And we know that LGBTQ people are already affected more or have higher rates of smoking than cisgender individuals. Wow.
Yes, but you have to understand why. And it goes back to mental health. We're all isolated away from everyone. We're holding meetings or visiting family like this, over Zoom or Instagram Live or over Facebook. This is the most that we can get from community. When we don't have that in-person interaction, we really go to, unfortunately, a dark place mental health wise. So we're seeing substance abuse go up, tobacco usage going up. We're seeing, unfortunately, trigger warning here, self-harm go up and suicidal ideation as well. So this pandemic is taking so much out of so many people. And that's just from isolating from everyone. That's not including those that we've lost in our family due to COVID-19. So there's just all of these mental health stressors that everyone's experiencing. So really, how do we work together to navigate this and really ensure that we still have community to protect our community?
Yeah, and I think when you add to that, again, the current political climate we live in, where your race or your skin color can be the that's a social determinant now to health. That can be the reason why mortality goes up within certain populations. And I know we talked about intersectionalities, right? But could you imagine like someone who's African American and trans, and may possibly homeless, or someone might be Asian and queer. The levels of the stressors are so heightened. So yeah, I completely agree, Danny. Thank you for sharing that and for bringing that again.
Yeah, absolutely. I don't know if you're aware or not, but the American Medical Association just last year proclaimed racism as a public health crisis. So, now we're tackling racism in public health, and we're just trying to navigate what does this look like in public health and what is the appropriate way to tackle this. And really, it's bringing voices such as ours to the table to really talk about things and come up with upstream interventions, and really make these recommendations of this is how we tackle it.
Yeah, completely agree. This is coming to an end very soon, but just a few more questions, Danny. We've talked a little bit about cessation, right? Cessation being programs that exist that help people stop quitting. So are tobacco cessation programs effective? And can you give us some examples of what is tobacco cessation, what is not tobacco cessation?
Yeah, absolutely. So one, is tobacco cessation effective? It can be, yes, when it's coupled with mental health services, support group services, really having that whole healthcare team. And that's something, like I mentioned earlier, that we've really worked with the Quit Line. It's not just talking to a counselor, for 30, 45 minutes, a couple times, getting sent, nicotine patches and nicotine gum, but really digging in, of like, what is the root cause of the tobacco usage, and that's why I really like working with the Quit Line down at UC San Diego with Gary and Sharon and Sandra, because, they get it, they're understanding it now. And they're like, yes, let's put together these packets that we can give folks and show them, this is your local center. This is how you can get mental health services. This is how you can get support groups, so all of that coupled together, it really does work. What is not cessation services? The tobacco industry is really good at saying like, oh, vaping and e-cigarettes, that's a great cessation tool. Well, first off, it's not FDA approved, and the tobacco industry hasn't even done research on if it's a good cessation tool or not. They're just saying it is. So because there's not research done on it, the FDA is saying this is not a cessation tool. And the truth is that for every vaping or e-cigarette product, the amount of nicotine in it over the lifespan of that pen is pretty much equivalent to like 20, 25 packs of cigarettes. Wow. So really just think about it, of that one hit that you take, you could be inhaling anywhere from like 1 to 2 cigarettes worth of nicotine in that one puff.
Yeah.
So, you know, really when you think about it, you know, it's really working together, you know, with your local center, with their mental health program, with their support group program, working with the quit line, you know, and the services they have. You know, it's going to take a lot more work, but when you have that whole health team, it really sets you up for success to succeed, to quit the habit altogether. Because again, you're starting to address, why are you utilizing that product? Why is it your go-to?
Yeah. And you know, I mentioned earlier when we began the conversation that we recently just launched a tobacco cessation program at the center. So if you or anybody you know or love is considering quitting and needs some support, don't hesitate. Give us a call, 714-953-5428. Ask to speak with someone from the tobacco program. We are happy to help you. We have a very holistic program where we also connect you to mental health services. We will talk to you to see what other health services you need so we can make those linkages and make sure that you're taken care of. You can also find us online. You can go to our website, www.LGBTQ Center OC. Under programs, look at the tobacco. Under programs, look at the tobacco program, and you will find the intake form there, and someone from the team will reach out and provide that one-on-one support to link you to cessation services in the area to make sure that you stay healthy and you're taken care of, because that's what we're doing this for. We want to make sure that our community is safe and healthy and thriving and living the best possible life that they can. Dannie, you are such an inspiration. You've been a health advocate for years. And I love it because you've paved your own way. Like, this is one of the reasons why I admire you so much. You have paved your own way. You are such a strong, confident person, caring about the community, about changing the world. So my final question to you is this: what advice can you give a trans person who wants to become or who wants to self-advocate for themselves? Because that can be very hard sometimes.
You know what? It can be very hard, and it gets tiring, you know. Even I get tired of self-advocating for myself. There's times where I'm like, what's the point? If there's any advice I can give you, is have friends and have people in your corner that you can vent to, that you can cry to. You know, stay involved in the center. You know, the center OC is a great place. You know, their mental health services are top notch. Their social support groups are amazing. You know, really staying involved and having the support behind you as you self-advocate is really important, because it wears you down. I'm not gonna lie. You know, you get worn down, you get frustrated, you're just like, why even fight anymore? You know, just right before this Instagram live, I was at the pharmacy, you know, fighting with the pharmacy for my meds that I need, you know, and you get tired, you know. So have people in your corner that you can decompress with, you know. Have friends that you trust that you can just be like, I need to vent. Go to the support groups where you're going to have folks cheering you on, and they'll even say right there with you, like, you know what, we get it, you know, be angry, be mad, you know, use every cuss word in the dictionary if you have to. Those are safe places for you, and the center is a good place to get that type of support, to decompress from having to self-advocate. You know, don't do it alone. And if you need someone with you as you're on the phone advocating for yourself, or as you're at the pharmacy advocating for yourself, or even if you're going to the doctor and you don't want to go alone, you have every right to take someone with you. It's always good to have someone in your corner.
That was wonderful advice. Dannie, thank you so much. I can't thank you enough for this. Almost as good as old times. I wish I had you in front of me so we can have a hug and grab a beer now. Can we say that? No. But just to have you in front and just give you a big hug. Dannie, thank you so much. Any last parting words you want to give the people tonight?
You know, get involved in the center. You know, yes, we're still in the pandemic, but there's still lots of ways you can get involved, either through therapy, social support groups, or if you're like, you know what, I just want to make new friends, volunteer. You know, they could always use more volunteers. I know your 50th anniversary is coming up and you have a big event, you know, reach out, you know, get involved. That's what I would encourage. You know, I know right now, you know, we're not going to bars or clubs or drag brunch, which I'm really sad about because I miss drag brunch. So, you know, find community at the center.
Thank you. Completely agree. We have we're celebrating 50 years of being in Orange County, fighting this fight, fighting equity for the LGBTQ community of Orange County for 50 years. So we definitely could always use volunteers. Yes, we actually also have Trans Pride, which is something Dannie, I remember when we did Trans Pride the first time, Dannie showed up and in 2 weeks threw a huge event with like 50 cents. And then we stayed up all night for 2 nights in a row, putting things together for that event. But I mean, we have Trans Pride coming up this summer. We're going to pick up the Hermosa y Protegida pageant. So there's a lot of spaces to get involved, to be a part of the community, to create change for your community. And again, if any of you or any loved ones need help quitting, give us a call. We're here to help. Everybody have a really good night. Dannie, I love you, man. Thank you so much for being here.
Anytime.
Have a great night, everybody.
Night.